Thanks very much, Cassandra. First, I just wanted to thank my mentors, Steve Albertoli and Lakshmi Karan. Where are you? Do you hear that? Excellent. Brilliant, both of them. And I highly recommend them as mentors if ever any of you want to be menteed by anyone. Really impressive. So let me first start off by sharing with you a story of a remarkable young lady called Maria. The first time I met her, I asked Maria, what do you want to become when you grow up? And she said, I want to become an astronaut. Now, for me, that was really mind-blowing, especially coming from a 10-year-old girl from Pakistan who was the daughter of a maid in a country which barely has a space program. Unfortunately for Maria, her life unraveled when her father, an auto mechanic who worked at a car dealership, ended up having a massive stroke. He was taken to the nearest public hospital, not diagnosed in time, not treated in time, and ended up completely incapacitated. The impact of this medical event on Maria and her siblings were that they were all pulled out of school, put in urban child labor situations. So 2 ended up working on the streets, 2 ended up in the apprentice in a car dealership, and 2 ended up working as girl child labor. All 6 of them ended up being physically, psychologically, and in some cases even sexually abused. Now, the reason I'm telling you this story is because I wanted you to understand that not having health insurance or not having a safety net can really financially decimate low-income families in the developing world. And this is something that it behooves all of us to do something about. There are hundreds of millions of Marias in the developing world, and there are 87 million of them, in fact, in Pakistan alone. They constitute the missing middle, or the working poor. And at Naya Jeevan, it's our mission to rejuvenate their lives and to provide them with access to safety nets like health, life, and disability insurance. Now, the way we do this is actually somewhat novel, and this is perhaps our secret sauce. And in fact, to many Americans, it's quite counterintuitive. So what we do is we partner with large corporations, large corporate clients. We identify low-income stakeholders who are in their value chains. These low-income stakeholders could be smallholder farmers that are providing milk to dairy companies. There might be small business retailers that are selling shampoo or soap products which belong to P&G or Unilever. Or they might be low-income, informal domestic workers who happen to be working in the houses of corporate managers and executives. And what we do is we aggregate these low-income populations. We negotiate and buy large group health plans from various insurance companies, and then we embellish these plans with a huge emphasis on prevention and telemedicine. And I'll describe what we do in a bit. But perhaps most fascinating is the fact that we actually get these corporations to co-finance these plans. And they do this as part of market-based loyalty or incentive programs. Now, you might be wondering, why on earth would a corporation want to enroll or provide health insurance to low-income suppliers at the end of their supply chains? And there are 3 reasons. Number 1 is that we, as I mentioned, structure retail incentive programs. So this actually moves or impacts the bottom line of these corporations. Number 2, if I can get the clicker to work, is that a lot of companies often have CSR obligations, especially in the oil and gas sector. And so for these companies, that type of CSR is more strategically aligned with their core business. And number 3 is that most of these companies have a long-term horizon. They're in it for the long run. Most of them are consumer good companies, and they understand that they need to, if they are to grow themselves, they need to empower and bring low-income people into the middle class to enable them to become empowered consumers. So, just to kind of give you more details about our plan, we have a core health plan, which is very similar to what you would experience in the US. It gives you cashless nationwide access to a network of health venues. But most importantly, what we have done is we have wrapped around that plan our own services. And perhaps the most important of these is the 24-hour, 7-day-a-week access to family medical doctors. So our members can call a family doctor at any time, 24/7, and ask them, seek guidance, navigation, etc. And it remains our most popular service. In addition, we've packaged a number of other key preventive health services, including home health visits, that are really designed to deliver and address the healthcare needs of these low-income, marginalized communities. The product of the health plan costs $30 per person per year. That's $2.50 per person per month. a staggeringly low number for Americans, less than a cup of Starbucks, in fact. Of that $30 that we receive, and we only collect centrally from corporations on behalf of their supply chains, $18 goes to underwrite the risk or the health insurance underwriting costs. $3 covers our telemedicine medical services. $4 covers our OPEX, generating a net profit of $5 or about 15% net profit margin. And with that net profit margin, we're able to scale, and we believe we can scale quite rapidly. Over the last 5 years, we've achieved a number of pivotal milestones, if you will. Perhaps the most important one is that we've now provided over 300,000 lives with access to high-quality primary care, and over 65,000 lives affiliated with the corporate sector with access to our health insurance program. But we're not stopping here. These milestones have enabled us to set the tone, if you will, to scale more rapidly. And we're certainly at an inflection point where with an injection of appropriate capital, we can scale rapidly, achieve profitability in 2017, and generate more than $30 million of revenue by 2020. Now in Pakistan, $30 million goes a long way. It's almost the equivalent of $150 million. So I want you to keep that in mind in terms of what the impact of this can be on the lives of these communities. Now you might be wondering, well, why are we so confident about this? One of the reasons is we've already raised a lot of money from a lot of credible donors, some of them that require extremely rigorous reporting. And so that has made us resilient and has really enabled us or given us the capacity to seek additional investments. In addition, we've done the hard work of establishing and initiating relationships with a number of large corporations. So the hard work has already been done. Now what we need to do is we need to drill down, go much deeper into their value chains, starting from distributors to retailers to micro-retailers. Just to give you an example, right now we've enrolled 3,000 distributors who belong to Unilever's distribution system. Those distributors reach out to 600,000 retailers in Pakistan. So that gives you a sense of the amplification that is possible with this type of model. And finally, we have a really experienced team that has been there and done this. Most of us are doctors and MBAs, and there are 25 of us, and we're all very committed to making this model successful, not only in Pakistan, but in other developing countries, and even in developed countries, including the US, eventually. So, our ask is fairly simple, $1.35 million, structured into three components, $600,000 in equity, $500,000 structured as a credit line or convertible or mezzanine debt, and $250,000, which will help finance a very innovative and exciting digital health solution that we are integrating into our health plan. How are we going to use these proceeds? Aside from the R&D, the biggest proceeds are going to be used to significantly expand our sales force. We're in a very relationship-intense business. People like to do business eye to eye and meet and shake each other's hands. We have reached our capacity with the 4 reps that we currently have, and so we now need to scale to 32 field reps across the country who can really deepen the relationships with the value chains affiliated with the corporations that I mentioned earlier. In addition, we need to do B2B, business-to-business marketing, to have much more credibility across the nation, especially amongst the distributors and retailers who may not be as familiar with our brand name as the corporates are. So we need to establish that brand corporate identity, for which we need to launch a campaign targeted towards distributors and retailers. In order to capacitate and to serve or provide services to the sales force, we need to embellish and upgrade our IT systems. And finally, we need to hire both a COO and CTO who can take our organization to the next level. Finally, I want to conclude by coming back to where I started off from. Essentially, this is why we're doing this. This is exactly, Maria is the reason why we do the work we do. And this is an opportunity for all of us, you and I, to really engage and to really transform the lives of girls like this. It's a very difficult journey that we're embarking on. It's very, very hard work. But I can guarantee you that it's also very gratifying. All you need to do is to look at the sparkle in her eye to know what it might feel like when a girl, a young girl in Pakistan, has the opportunity and has been given the safety net to be able to spread her wings and learn to fly. Thank you.